My biggest dream as a child was to become Supergirl. When other girls sat with Barbies and were busy playing mommy, I was preoccupied with a wild adventure to save the world. So in 2001, I thought I'd finally found a chance to accomplish my big dream when my best friend Sheila was diagnosed with breast cancer. I was with her throughout her journey when she had to go for chemo and all the other sessions. I knew being Supergirl meant pouring on her as much love to fill her body with strength to fight the cancerous disease. But Supergirl was limited in administering medication. I had no knowledge of what was happening to my friend internally. Some days we felt she was making progress. Other days, we needed a prayer to get her through the next day. Doctors did their best, but the treatments were not targeting the cancer stem cells. And one day, Sheila was gone. And Supergirl had lost her chance to save her friend. Cancer is a leading cause of death worldwide, accounting for nearly 10 million deaths in 2020, or nearly 1 in 6 deaths, according to the World Health Organization. Although there have been some improvements in the treatment of cancer since 2001, when Sheila passed, humanity needs a breakthrough to reduce the fatality associated with cancer. Some of the existing limitations in the treatment of cancer is lack of epigenetic profiling and specificity of existing epi drugs. In fact, a 2017 study shows that a deep learning AI model can diagnose breast cancer at a higher rate than 11 pathologists. AI can accurately identify the primary stem of the cancer and empower medical professionals to administer appropriate treatment for the stem cell. But cancer isn't the only challenges that the healthcare industry is faced with. Healthcare is becoming increasingly expensive, and it's only a matter of time the accessibility rate will drop. But using AI to make processes such as diagnosis more efficient can often be run at a fraction of the original cost. For example, if AI can analyze millions of images for signs of disease, it removes the costly manual work involved. Patients are treated faster and more efficiently, reducing admissions, waiting times, and the needs for beds. Healthcare facilities are now typically crowded and chaotic, making for a poor patient experience. In fact, a study shows that 83% of patients describe poor communication as the worst part of their patient experience. Leveraging AI can help rapidly scan through data, get reports, and direct patients where to go and who to see more quickly, and avoiding the usual confusion in the healthcare environments. AI technology for patients has another unbeatable advantage. It's available 24/7. Still keeping my Supergirl dream alive and partly to set up a legacy for my dear friend Sheila, I began researching for a solution to cancer and then discovered Hanson Robotics, where I now work as a communication strategist, advocating for quality, accessible healthcare through the utilization of artificial intelligence. The core of our values at Hanson Robotics is to nurture robots to provide deep and meaningful interactions with humans. We're dedicated to creating socially intelligent machines that enrich the quality of our lives. Hanson has created over 24 models of intelligent machines that enrich the quality of our lives. We're talking about robots with good aesthetic designs, rich personalities, social cognitive intelligence to empower humans in every facet of society. The target is to produce these models in hundreds of thousands in the next 10 years. Our star model is Sophia, famous Sophia, famous Sophia. She can copy over 60 facial expressions, hold interactive conversations, sing, recognize people, and she is the first humanoid to receive citizenship and ambassador for the United Nations Development Program. Sophia is one of the biggest breakthroughs in the healthcare industry. She can speak 5 different languages, understands human emotions, and has been trained to empower direct care workers with sophisticated detection of hemorrhoids, nodes, and moles. Most of all, Sophia is almost 70% sentient, which means she's able to process her thoughts to some degree. Do you know that Sophia has a little sister? Have you met her? Little Sophia can read, can sing, can take vitals, and alert medical experts during emergencies. I wanted to be there for Sheila. I had the will, but lacked the knowledge. Sophia and the many others who are being manufactured or fabricated at our factories in Hong Kong have the will to offer precise, efficient, infallible medical investigations and care support for the entire world, especially for the 703 million elderly people in the world 247. In fact, there are predictions that people who age 65 and above will double by 2050. So we're looking at about 1,400 or so people. And 1 out of this age demography live alone. They're lonely and isolated and are vulnerable to terminal diseases. 1 in 3 of the same age group fall down each year. There are 18 million direct healthcare workers within the same age brackets. Now, imagine using sophisticated technology to combat these challenges to create a world that is safe, healthy, and happy. We can beat down the stressors of our medical workforce. We can provide companionship for our aged and even the young ones. We can reduce human errors in medical treatments by over 80%. Conduct efficient and effective clinical trials at reduced costs. Interestingly, according to Research and Markets, the global artificial intelligence in healthcare market size is expected to grow from about $6.1 billion in 2021, and then it should reach about $64.11 by 2027. That's approximately 48% CAGR. So we are not just offering humanoids to improve the quality of our lives as humans. We're also providing investment opportunities for investors like you. This is the future I dreamt of in 2001 when I lost Sheila. The future where advanced AI solutions will mitigate the tormentors of human health, and timely too. This is a future where we all can be supergirls, taking control of our lives and the world through the optimization of humanoids.